Before the break, we told you 57 million Americans are at risk for developing something. We're talking about prediabetes. If left undiagnosed, it can lead to full-blown diabetes and major complications. And joining us in our studio audience today to talk about this is Minute Clinic nurse practitioner Kelly Kell. Welcome, Kelly.
Thank you.
Good to have you back on. And what I want to emphasize to everyone is that prediabetes is where your blood sugar levels are high, but not high enough to be diagnosed with actual diabetes. Why is that important? Because diabetes can either be avoided or delayed, and the complications in many cases can be avoided, but you got to have early diagnosis. Of course, it's difficult because the symptoms sometimes are so subtle, Jim.
And then, that brings up the different types of diabetes. First off, there's type 1 diabetes, and that's also called childhood diabetes because it usually starts in childhood. And basically, the pancreas gets damaged by illness or a virus or something and stops making insulin, so the body can't process sugar. The symptoms, which is most important, frequent urination or excessive thirst or unexpected weight loss.
And in type 2 diabetes, typically that develops over time, happening more and more in our younger folks. But your body does produce insulin. Your body, though, doesn't respond to it the way it did before, so your blood glucose levels still get too high. And the thing is, you put yourself at risk for infections. You can have numbness and tingling in your hands and feet, and a lot of other very subtle symptoms that can lead to heart disease, kidney problems. So early detection is key. And Kelly, talk to us about detection, which does lead to prevention.
Sure, absolutely. So Minute Clinic offers screenings. Our patients are 18 years of age and older, and we just take a little bit of blood from the finger, and the results are usually ready in about a couple minutes, and we'll review those numbers with the patient and kind of talk about what those numbers mean.
And who should get tested?
So generally we say adults 45 years and older should get screened every 3 years unless you have some increased risk for diabetes. So if you have obesity or if you have someone in your family that's diabetic, then we recommend more frequent screenings.
So screening is so very important, and if you think you may be at risk, you've got to consult your primary care doctor. Kelly, thanks for being with us today. We appreciate it. Now, more tips to keep you and your family healthy are coming up after the break.